Hi guys, my name's Katie. I'm going to be taking you on a run through of the Module 1 of the dance exam. Dance is the Dental Anesthesia Assistant National Certification Exam, so you should have a booklet that looks something like this. So Module 1 begins by talking about the nervous system. The nervous system is broken into three parts: central, peripheral, and autonomic. The central nervous system consists of your brain and your spinal cord. Peripheral consists of sensory and motor nerves, most important of which, and which is definitely going to be on your exam, is the trigeminal nerve. So the trigeminal nerve helps send sensation to teeth and jaws, and motor branches for mastication, which is also known as chewing. The autonomic nervous system is for internal organs and involuntary functions. It's subdivided into two parts: sympathetic and parasympathetic. Sympathetic basically speeds up your body's reactions, perfect example of which is during pregnancy when you're giving birth. It would increase the frequency of contractions, increase heart rate and blood pressure and blood glucose, and basically is responsible for that fight or flight response that our bodies have when we're in stressful situations. Parasympathetic, on the other hand, is more of a maintaining and slowing your body's systems. So it would decrease your heart rate. On the other hand, it would increase salivation and increase digestion. It's that part of your body that helps you be a couch potato. We're also responsible for knowing the flow of blood throughout the heart. So blood starts unoxygenated in your body's extremities and goes to your heart through the superior and inferior vena cava. It goes on your right side first, so it begins in the right atrium, through the tricuspid valve and your right ventricle, through the pulmonary valve to the pulmonary artery. That takes it to the lungs to become oxygenated. Once the blood is oxygenated, it goes through the pulmonary vein and into the left side of the heart. So the left atrium through the bicuspid valve, also known as the mitral valve, the left ventricle, the aortic valve, and finally to the aorta, which can take it to the rest of the body. One of the major vital signs that we take as dental assistants or oral surgery assistants is blood pressure. So blood pressure is systolic over diastolic, which is normally 120 over 80, somewhere within that range. Systolic pressure measures the pressure in the arteries when ventricles contract, and then diastolic is the opposite, so it measures the pressure in the arteries when the ventricles are relaxed. On my exam, I was responsible for knowing some vocabulary terms such as stroke volume. So normal stroke volume is around 60 milliliters. It measures the amount of blood pumped by the left ventricle each beat. The cardiac output, on the other hand, is the amount of blood pumped through the left ventricle per minute. So we also need to know the parts of an EKG. Not only are we responsible for being able to identify different dysrhythmias, but we're also responsible for knowing the P wave, which is atrial depolarization, the QRS complex, which is ventricular depolarization, and the T wave, which is ventricular repolarization. So we should definitely be able to recognize the parts of a normal EKG. We're also responsible for different anatomy of vasculature, so we should know the brachiocephalic, the different carotid arteries, the facial, lingual, maxillary, alveolar, and mental arteries. We should also know the blood vessels in the arm that are important for venipuncture. So that includes the brachial artery, which is subdivided into the radial and ulnar arteries. So an important side note of this is the really big consequences of intra-arterial injection. So if that happens, it's pretty serious and it could lead to total loss of the limb. That mainly happens if someone is going in blind and can't see where they're feeling for, or the needle goes too deep. So we really want to be looking at visible veins. It's important to use alcohol wipes too and keep the area sterile to prevent phlebitis, which is inflammation of the vein, and it can be pretty painful for the patients. We're responsible for also knowing the different anatomy of the respiratory system. So the upper respiratory system consists of the pharynx, which is subdivided into 3 categories: the naso, the oro, and the laryngopharynx. We need to know the epiglottis, the larynx, the vocal cords, the thyroid, and cricoid cartilage. So these 2 parts of the respiratory system are important in the case of an upper airway obstruction that cannot be resolved using other methods. Really extreme cases hopefully would never happen in your office, but we should be prepared with knowing how to do a cricothyroidotomy. So there should be some type of crico kit in your office. Through the lower airway is the trachea, the right and left bronchi, the bronchioles, the alveoli, and we should also know the respiratory muscles, most importantly the intercostals and the diaphragm. Our O2 saturation when we're taking care of patients under GA or anything like that should be at least 95%, aiming for 100%. If it starts falling below 95%, that's when you should definitely be alerting your oral surgeon. We also need to know some basics of the endocrine system, which controls hormones. The most important, or one of the most important organs of the endocrine system is the pancreas, which is responsible for glucagon and insulin. So that's when we hear about diabetes. So type 1 is insulin dependent, type 2 is insulin independent. The adrenal glands are responsible for producing epinephrine as well as corticosteroid release. The thyroid gland is a big one as well. It's responsible for the basal metabolic rate. We also need to consider the immune system, which is going to be important for healing. So unfortunately, the immune system is attacked by HIV, which is human immunodeficiency virus, which can progress to AIDS. So keep an eye out for those patients because they may need extra drugs and care because their healing processes can be slowed down. The immune system is also responsible for allergic reactions, and we're concerned about anaphylaxis. The liver metabolizes all of the drugs that we use during GA, and the kidneys are a big part of this as well because they're responsible for filtration. They're the primary part of the urinary system, and they also have a major effect on blood pressure. So that's the main points of Module 1. If you have any questions, please go ahead and leave them down in the comments. I hope this really helped you. Good luck!